How concerned are you?
Well, we are concerned, as you can imagine. I mean, we've done a fantastic job as a community, in our community, fighting this virus for months, and we certainly don't want to go backward. Obviously, the concern is what you've talked about at the top of the hour with increased cases in Texas, and certainly we're also seeing some of that bump here in our community, and that is concerning to all of us.
Did Texas reopen too soon?
It's a tough question. I will say that there was contribution to reopening across the country, right? Reopening means that you're going to have increased people getting together and potential for transmission. But what we don't know is how much that has contributed. We also know what I call it is a layering effect. It's all the reopening, but on top of that, it's milestone events like Mother's Day, Memorial Day weekend, activities, graduations that all come in to play, and it becomes really hard to then untangle it.
Do you think people in your state have been too complacent about the virus? Are people wearing masks and gloves? Are they distancing as you would like?
Well, this is again a challenging question, because I do think there's an incredible amount of people in our community specifically and across Texas that are listening to those messages. And we have been saying, look, you can reopen, but you can also reopen safely with health and safety in mind. When you see people out, you do see masks, you do see people social distancing, but you're not seeing it everywhere all the time with everyone. And I think this is where the medical community comes in. A doc like me, when we wear masks or we do something in the medical, facility, in a healthcare facility, we know we have to be meticulous about it, and it has to be universal. But when it's summer, it's 90 degrees outside, people say, gosh, I wore it yesterday, maybe I wore it this morning, but not now in the afternoon. You have to be 100% about it, and that's the real challenge.
I'm sure you're watching your hospitals very closely. What can you tell us tonight? How close to capacity are emergency rooms and hospitals in general?
Well, we've been watching a lot of indicators. Our county leadership, led by Judge Lena Hidalgo, and even in the city with Mayor Turner, there's been a lot of real activity. We've been working with our Texas Medical Center colleagues. TMC, Texas Medical Center, is the largest in the world, and there are an incredible amount of institutions. I'm a 20-year, proud member of TMC institutions. What I will say is that you've seen an increase, especially in the ICUs. And it was previously somewhere in that 10, 11% were COVID-19 positive. It's inched up, and now we're seeing it at 15%, which may sound not a lot, but it's enough that makes us worried that this may be the beginning. And so we want to make sure that people are not complacent, and any inconsistent messaging that's coming from a national, state, or local level can cause complacency and confusion at the local level with the community member who says, gosh, if they don't have all the information consistent, maybe I do not need to worry about this. But we want to remind everybody that this pandemic is with us. If we are tired of this virus is not tired of us. It's up to all of us to fight it for our communities.
Have you spoken with Governor Abbott lately? Do you know what his level of concern is? Either you're speaking to him or the mayor of Houston?
Yeah, I haven't spoken, but obviously we're in touch with the Department of State Health Services and folks that are on the health side of the house. And I know our elected leadership have been having discussions with all sorts of the policymakers at the state level. I will say that everybody recognizes that we have gotten to this point where we want to see our communities reopen, because we want to make sure that the economy and what this incredible disruption on people's lives, that is addressed, it's improved, and we can move forward. But we have to do it safely. And health protocols, especially in establishments like restaurants and other places, it's not just about the restaurant owner or the establishment owner. It's also about the consumer and the customer saying, I've got a choice to make between two establishments, one following the health protocol, one maybe not so much. I'm going to vote with my feet and go to the one that's actually following those health protocols. That's what we're relying on, but we also have to rely on those policymakers to make sure that those policies are consistent with health and medical as well.